You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people that are suffering from hypothyroidism. She's been on the program before to talk about diabetes. Dr. Carter. Dr. Carter, welcome to the program.
Thank you. It's great to be here, Randy.
So what is your role at the center?
I'm the clinic director at Integrative Health of Philadelphia.
So you're, we have you talking about thyroid, but your center, you guys focus on three main things. Is that correct?
Yes, we do. Specifically, we work with patients who are suffering with type 2 diabetes, as well as patients who are experiencing hypothyroid symptoms, as well as peripheral neuropathy. So, we're seeing patients who are dealing with these conditions and end up frustrated with the other types of results that they're
Now, tell me about the staff. I mean, you have a medical doctor, you have...
We do. We have an integrative team. Basically, we're working with medical, alternative, allied health professionals, all working together synergistically to work with our patients in order to have all the tools that we need to give them the best outcome that we can.
Hypothyroidism. Am I saying it right?
Hypothyroidism.
Hypothyroidism, okay. Define it for me. What does it mean, and what are the symptoms?
So hypothyroidism is essentially, if you break it down, hypo means slowing down. Thyroid is the gland that's located in the lower portion of your neck. So that means the thyroid gland has slowed down. It's not working as efficiently as it should be, or as it used to be able to. So the symptoms that can go along with hypothyroidism, a lot of people identify
what are the symptoms?
With. Well, of course, you have fatigue. So unnatural sleepiness, or feeling tired throughout the day. They're not able to sleep well at night, also causing the fatigue, getting up multiple times, just for no reason, it seems to be, and they can't fall back asleep. Also, dry hair, skin and nails, the hair loss, either from the head, the eyebrows, the eyelashes.
Really? Okay.
Yeah, they can experience hair loss from other areas of their body too. It seems to be for no reason. But
and that's a slow when you hear like sluggish thyroid or low thyroid, they're talking about hypothyroid.
Exactly.
Okay.
So some of the other symptoms that can go along with that sluggish or that low thyroid could also be bowel and digestive problems. Most commonly is constipation.
Really?
Yeah, actually, because those thyroid hormones are stimulating the movement through the gut. So as soon as those thyroid hormones don't get to that area, gut motility slows down. Patient ends up constipated. But I'll tell you, sometimes it's a battle between constipation and diarrhea, and then they get diagnosed with IBS. Really, this is just a symptom of the hypothyroidism.
Really? Have you had people that, I'm interrupting you, but
That's okay.
Where thyroid was their problem, their constipation went away?
Absolutely.
Because I know it's more than one thing.
Right,
honestly.
of course.
But you had people that really, their constipation turned around?
Yeah, and constipation is such a condition that is so uncomfortable when these patients are dealing with this day in, day out, and they're trying to treat that symptom, right? They're taking,
fiber, etc.
Right, whatever it may be to help with this issue, and it's not working, of course, because the cause of the problem is still present. So, you can't chase the symptoms if the cause of the problem is still there.
So, but with weight issues, gaining weight.
Yes, that is something
with
that
the thyroid?
Absolutely. A lot of patients are experiencing weight gain when dealing with hypothyroidism. I've got patients that are telling me they've tried everything. They've done the weight loss clinics, the special diets, the personal trainers, doing all these different things, and they're saying it's working for everybody else, but no matter what I do, it will not work for me. The weight just will not budge.
Okay.
Or they're having problems losing weight where this has never had been an issue in their life before. So we see that that's a very common symptom.
So you run a test, and you can clearly see that they have a
low
most
thyroid. Most of our patients come in with the diagnosis of having hypothyroidism.
Oh, already? Okay.
Right. So let me tell you, the typical patient, coming into the office is that they've been diagnosed with hypothyroidism. Most of them are on thyroid hormone medications, whatever it may be, some type of thyroid hormone replacement, and their symptoms are still there.
Okay.
Saying I'm taking the medications, I'm doing exactly what my doctor tells me to do, but no matter what, my symptoms are still progressing. Okay. So that's, basically what we see our patients coming in with, and they end up being frustrated.
You mentioned some of the symptoms.
Yes.
I mean, you rattle off like 30 or 40 on the telephone when we talk, but what are some of the other symptoms?
There's so many other things. Of course, another very common one is brain fog, concentration issues, problems focusing. A lot of people don't always make that connection that that's the hypothyroidism. Those thyroid hormones are also stimulating the area of the brain that's helping to control memory. So as you're not getting those thyroid hormones there efficiently, the memory is affected. Can't remember people's names or where you put your keys or, what they talked about in a meeting last week. A lot of the thyroid patients you'll see will always be carrying around a planner. They say, I've got to write everything down. If I didn't write it down, it didn't happen or it's not gonna.
Okay.
They're very commonly list makers, having to keep track of everything that's going on
and
because the memory
issue. And it could be a thyroid
issue.
problem.
Absolutely. That brain fog is one thing that we very commonly see our patients coming in with. Also, in addition to the brain fog, the memory, concentration issues, also patients are experiencing issues with mood, irritability, feeling on edge. They'll tell me, I feel like my fuse has just gotten really short. And I was
Really?
never like that before. Patients tell me, I used to have that laid back, patient attitude, and now I'm just, constantly on edge and feeling like I'm snapping at the drop of a hat.
Now, I know this is a big topic, but
Sure.
what's the connection? Could you give me a dummied down answer of, what's the connection with thyroid and mood?
Well,
Because I think of it as amping you up, like an idle in a car. And you're
Right.
saying it could calm certain people or make them less edgy.
exactly.
Okay.
Make them less edgy. I mean, basically, Randy, these patients are feeling terrible on a day in, day out basis. You think about when you're physically feeling bad
No
every
energy.
day, this is going to affect their emotional health
Got
too.
it. Okay.
Which is why, and they get frustrated, right? They get discouraged. They're doing all the things that they're told to do. The their doctor tells them you've got to take your thyroid hormone medications, an hour before you eat every morning. You've got to diet, you've got to exercise, and you'll be fine. And they're doing all of that, and they're still not feeling fine. One of the most frustrating things a thyroid patient can hear from their doctor is, your labs look great, you're doing fine. They don't want to hear that because they're not feeling fine.
Do they tell you they don't want to hear that?
Oh my goodness, yes. They want their doctor to find something, to do something different so they can start feeling differently, because why should their lab say that they're normal and they're fine if they're not feeling that way? That's why that ends up being so
So
discouraging
how do
for
you
them.
differ then, your center? How do you differ in your approach to the thyroid than just giving them thyroid medication?
Right, because first of
Do
all,
you pull them off the thyroid medication?
no, let me just tell you that if the patient is not making thyroid hormones, for whatever reason, whatever the cause may be, they need to be getting it from somewhere. Thyroid hormones are so critical, which is where that whole laundry list of symptoms come from, is those thyroid hormones are stimulating almost every cell in the body. Almost every one of your cells has a thyroid hormone receptor. So this is why, in addition to all those other things I explained, but also muscle aches or headaches or other problems.
Like migraines, things like that as well?
Yeah, headache first thing in the morning and that dissipates throughout the day. That's your classic hypothyroid headache. So all those other conditions come about.
Cold hands and feet?
Cold hands and feet, absolutely. Swelling, puffy face, or you can see trophic changes too in the skin. Like I was talking about, the dryness, but also paleness of the hands and the feet also can be related because, like I said, those thyroid hormones, they're not getting to those areas. So those areas end up being affected.
So, and I interrupted you, but traditional approach to thyroid problem is test, give them a
Thyroid
medication,
hormone replacement.
and then just kind of retest in the future.
Exactly.
How are you different than that?
Well, I'm going to tell you right now, there's more to it than that.
Okay.
Basically, the conventional, traditional treatment is approaching these patients as a TSH level. So the main goal of the treatment is to have the TSH level, at it in an
TSH
appropriate
is
range.
what?
The thyroid stimulating hormone.
Okay.
Which, let me tell you, it's not even coming from the thyroid, it's coming from an area in the brain that's stimulating the thyroid to work. So there's a lot of different reasons as to why that TSH level is out of that reference range in the first place.
Okay.
That's what needs to be understood for these patients. So we do more thyroid testing. We understand exactly why is the TSH level elevated in the first place, because they've actually identified over 25 different things that can cause a high TSH level or a low thyroid function. Those different things, just to name a few, could be adrenal deficiency, also pituitary hypofunction, which is what's creating or producing that TSH level. Also things like chronic infections or inflammation or digestive problems or nutrient deficiencies, heavy metal toxicity. I mean, the list goes
All
on
of
and on
these
and
things
on.
could be affecting this thyroid. So
Yes.
will their medication work better when you address some of these, as you call it, underlying causes?
Well, yeah, I mean, basically, let's just say, let me give you an example. If a patient has a primary hypothyroid problem, if they have a primary thyroid condition, patient takes thyroid hormone medication, they'll feel better because their problem is resolved, right? These patients who are taking the thyroid hormone medication and still not feeling better, their problem has not been resolved. Symptoms that these patients are having is a warning sign that there's something going on in the body. So if their symptoms continue, regardless of the thyroid hormone replacement, that tells us that the cause of the problem is still there. Now, I was listing off some of those causes to you, but I want to talk about something that's a very common, let's say, misconception nowadays, is that iodine deficiency can actually create hypothyroidism, which is, yes, it can.
Does that come up? I mean, the people that have thyroid problems, they know this.
Yes.
I mean,
They commonly think, oh, well, maybe I should be taking iodine, or maybe someone has recommended that they take iodine for having a hypothyroid state. Well, I'm going to tell you that the number one cause here in the United States is not iodine deficiency. It's very common.
Is there science to back up the statement you just made?
Absolutely.
Okay.
Yeah, I mean, that used to be an issue. I mean, an iodine deficiency can create a goiter, which is an enlarged thyroid, and there used to be areas in the United States called a goiter belt, because those areas weren't getting enough iodine in their diets because it wasn't in their soil or in their plants and whatnot.
Okay.
Right now, the United States, they have corrected that problem. There's plenty of
So
iodine.
it's not the iodine. What is it?
Okay. So let me just tell you. What'd you say?
I said, what are you finding?
Oh.
It's not the iodine.
Right. I mean, it's not the iodine now. Well, let me just tell you, because I know that this is a big thing right now for a lot of patients thinking about the iodine deficiency, that all their thyroid gland needs for iodine is 1 milligram of iodine a week. That's it. Okay. So that's about 90 to 100 micrograms of iodine a day. And if you're wondering exactly what that means in food consumption, a little carton of yogurt will give you 100 micrograms of iodine.
Okay.
So that's it.
That's
all you need. So I'm just saying that you're getting plenty of iodine throughout your foods here in the United States now.
So if it's not iodine, what is it?
You're wondering, aren't you?
Yes. Okay.
The number one cause here in the United States is actually something called Hashimoto's disease. Now, a lot of people are not familiar with that term. And if they're familiar with it, they're not always familiar with exactly what it is. It's an autoimmune disease.
Autoimmune.
Yes. Okay. What that means, are you familiar with autoimmune disease, what that term is?
A little bit.
Okay. Here, the immune system is recognizing the thyroid gland as foreign. Basically, it almost sees it as an infection or an allergen, and it makes antibodies, a little army, so to speak, to attack and destroy the thyroid. So there's specific antibodies being, it's an anti-thyroid peroxidase antibody and anti-thyroid globulin antibody.
So it attacks the thyroid.
Basically what I'm saying.
I looked up actually hypothyroid.
Okay.
No, actually Hashimoto's disease, because it was mentioned on your website before coming in today.
Good, I'm glad you did.
And so I have just literally a 2-minute understanding just from what I read. Mm-hmm. But so it's Hashimoto's disease is what you're saying it's being misdiagnosed?
It is, because right now these patients, let me tell you, when I say it's the number one cause, over 90% of patients who have hypothyroidism have actually have Hashimoto's. Okay. So they've been diagnosed with having a thyroid problem. So they're being treated as if they have a thyroid problem. No wonder the majority of these patients are not feeling any better in the end, because the cause of their problem is still active. So that's why I say they've been misdiagnosed.
Which is something that's attacking the thyroid. Am I getting this right?
Yes, is the immune system.
Okay.
Yeah, the immune system makes the antibodies to attack the thyroid. Of course, that's going to cause the thyroid to slow down.
What tests do you find out if they have this problem?
That's those antibodies that I was discussing.
But is there a biological marker for Hashimoto's disease?
Yeah, that's the two antibodies.
And what percentage off the top of your head do you find that they have Hashimoto's in your practice?
About 90% of them.
Oh, really? Interesting.
90% of these patients
who are... Is that an exaggeration? I'm kidding around.
That is not.
90%?
Absolutely not. No, because the hallmark tall tale sign of having Hashimoto's is taking thyroid hormone medications when you have a hypoactive, high TSH, and still not feeling any better.
Do you find more women, more men?
It primarily affects women.
And what is the age range?
The age range, this can go, primarily it's anywhere between 30 and 70. But I mean, I see younger kids, teenagers, who have been, diagnosed with hypothyroidism and actually have Hashimoto's. Okay, so we're seeing a very wide range.
90% of the time, and you see a lot of patients, so that's a lot of people.
Yeah, we do, and a lot of times too, the test can come back with false negatives, and we see that happening, very, very frequently because the immune system is overactive. From there, it essentially tires out, so it doesn't produce these antibodies the way that it should. So until there's a test that technology advances, it becomes more specific, then more and more of these patients will be able to be diagnosed properly.
Okay, so for people just tuning in, so they're taking thyroid medication, but they still have symptoms.
Correct.
Okay, blood work shows it's fine, but they still have the symptoms.
Correct.
You find in 90% of the time Hashimoto diagnosis, treat this immune problem. Mm-hmm. And then what happens? How soon do they start feeling better and saying, oh my goodness, this works?
Well, of course, that ranges for every patient.
Like what's the best scenario? I mean, what have you seen?
Best case scenario is day one, they start feeling better.
Really?
Of course we see that.
Oh, you do? Okay.
Yeah, I mean, that can happen. Of course, it's different for everybody as to what it may be.
Just on your experience, because you see patients.
So it can take a week for the patients to start.
That's it?
To start feeling better.
Okay.
Yeah, as soon as we start, identifying the cause as to... If it's the autoimmunity, there's your cause. But then there's the next question, well, why do they have the autoimmunity? Okay. Right? Where did that come from? Right. Why is the immune system overactive? Why is it all of a sudden recognizing the thyroid gland as foreign tissue? So as soon as we can identify what those triggers are, which is what we call them, which are the things that cause this condition to flare up. Okay, so first of all, we test. We do some further testing, understand exactly what's triggering this condition.
You do a lot of testing there, right? I mean, you're big on testing.
I'm going to tell you right now, what we do is we get answers. Okay. That's the bottom line. I've always been my entire life that person always asking why. Well, why? Why? Such a small question, but you get so much information from asking it. Especially with these patients, like I said, when they're having these symptoms day in, day out, there's a reason why. And that's what we need to understand in order to know best how to treat them.
do they get frustrated every once in a while? The patients go, how come I never heard this? How come my medical doctor didn't tell me this?
Of course, and that's usually...
I know you want to be positive here about, traditional medicine and things like that, but you hear that.
Right, of course. I said, of course it has a place, and it is so critical. If the patient is not making these thyroid hormones, for them to get them from somewhere. However, there's more to it than that. We've got to all work together in it for this patient.
Interesting.
Yeah, and that first visit that I have with the patient is I see a lot of frustration in them that they haven't gotten this answer before, and then some people have thought, well,
and do they look at you and say, "You're going to fix my thyroid"?
Well, yeah, and I mean,
okay.
it's treating the underlying cause as to why the thyroid gland's not working in the first place. The reason a lot of patients haven't heard of this condition, or maybe haven't been tested for it before, is because the conventional treatment is what they're already doing.
But there is science. I mean, there are conventional medical doctors that what you're saying that align with you. I mean, across the country. I mean, this is...
Absolutely.
Really? Okay.
Yeah, I mean, we're looking at, Dr. Wayne Sedano, Dr. Rangostani, Dr. Julian Whitaker,
These are all mainstream medical doctors, okay.
Yes, and they all understand that the underlying cause of hypothyroidism, over 90% of the time, is an autoimmunity.
Okay, good. Well, we're going to take a quick break. We come back, what you do to fix or boost their immune system. Okay, and heal this problem. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're talking about hypothyroidism and some of the new treatment options, cutting edge, new breakthroughs in the treatment. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options, new breakthroughs for the treatment of hypothyroidism. With us, we have an expert on the topic. She lectures on the topic, and it is Dr. Carter. Dr. Carter, okay, welcome back.
Thanks.
Now, for people just tuning in, okay, so your program, and it's Integrative Health of Philadelphia.
Correct.
You're from Philadelphia?
I am, born and raised.
Okay, good. And so the typical patient, they're already on thyroid hormone, is that right? But
yes.
They still have symptoms. What about the people, and I have this in my head, that they've had their thyroid removed?
I'm going to tell you, we do see a number of patients who have had their thyroid gland either partially or completely removed. Some of them have had what's called radioactive iodine because they've had hyperthyroidism. So they've obliterated the thyroid gland. So this is the reason, of course, why their thyroid gland's not working.
Okay.
However, they're taking the thyroid hormone and they're still not feeling well.
They still have the symptoms.
So again, the cause of the problem is still there.
When you say not feeling well, for people just tune in, fatigue,
cold
extremities,
weight gain, inability to lose weight, cold hands and feet, hair loss or dry hair, skin and nails, brain fog, concentration, memory issues.
So what's the answer for them though? Okay, so they don't have a thyroid, they're taking thyroid hormone.
Well, there's a reason as to why the thyroid gland was not working in the first place. Whether it was overactive or it was cancerous or there was multinodule, whatever it may be, the cause of the problem is still there if their symptoms continue with the use of thyroid hormones.
Do they have a Hashimotos?
Sometimes they do.
Okay.
Yeah, and believe it or not, I mean, I've seen patients who are making antibodies to the thyroid who don't even have a thyroid.
Okay.
It can certainly happen, but whatever the cause is, that's what needs to be identified.
So those people should not be ruled out.
Right, exactly.
With your program. And we should mention, if people want to find out more about your program, they can visit the website, but they could go in for a consultation. You meet with them individually in a group, is that right?
Yeah, so they can understand more about exactly what we do, and I can make sure that it really is a good fit for them.
Because people with, that are taking thyroid, usually they're pretty educated, I'm guessing, about this topic. What do they want to know? What are the frequently asked questions when they go, okay, Dr. Carter, I mean, what do they say every time? What do they want to know?
Well, I'm going to tell you, the typical thyroid patient has done the research. They've been through the gamut, the battery of different types of approaches, and they're usually really motivated to get well.
Oh, good. Okay.
But because of that, too, they're also
skeptical?
Skeptical, exactly, because they've tried a lot of things. They've heard promises, and they've been broken. The bottom line is that there are so many different things out there. But
what are you saying that they haven't heard before that you commonly hear?
It's individualized treatment. Bottom line is, I cannot work with an entire room of thyroid patients and say, all right, with all of you, I'm going to do this, this, and then this, and expect them all to get the same results.
So it's not just a standard protocol?
There's no way that that's going to work. Hypothyroidism is a highly individualized condition. A lot of people don't realize that, or they don't see it as that, but there are reasons, there are causes as to why their thyroid gland is not working. That's what's specifically worked on. It has to be customized to specifically how that patient's body is working. So the other thing is that these patients come in with this whole list of symptoms, other conditions going on, whether it's type 2 diabetes or IBS or hypertension, whatever it may be, and they're chasing all their symptoms. I mean, you see patients they've got a line of a specialist to be working on all those different problems. However, if the main cause of the problem is not identified, all those other symptoms are going to continue. So we need to treat the underlying disease.
So they'll go to you for hypothyroidism, and you're also going to address their type 2 diabetes, their other issues.
We treat patients.
Is that correct?
Exactly. We treat patients as a whole patient, as the patient, as an individual, not as a lab value or not as a symptom. Because we can't treat the symptoms. The bottom line is if the cause of the problem is still there, the symptoms are going to continue.
I asked your founder, one of the founders with your company, I said, what do you guys want to be known for? And he said results. Without hesitation, he said results. Tell me about your results.
Yeah, I mean, we are
with thyroid patients.
Of course,
what do you see? Give me some examples.
Well, some of the things that we see with patients, number one is energy level goes up. And it's one of the first things we see starting to turn around. That makes a huge impact on these patients' lives because patients, who are dealing with this condition, Randy, they are drained. And they feel like they've got the life sucked out of them. I've had a patient tell me once, I feel like someone injected me with cement because I'm just dragging through life. Wow. I feel like I'm walking so slowly in order to get through all those simple tasks. Okay, another example, patient said, I would wake up every morning. She used to make her bed, go about her day. Now she said, I wake up and I don't want to get out of my bed because I know I have to make it. So that simple task is becoming this huge chore.
But do you see reversals in these people?
So now we see that they're able to get up first thing in the morning, feeling refreshed, rejuvenated, ready to go, handle the day, do their tasks, work, come home, still have hobbies, still be able to cook or clean or spend time with their family, be able to golf or go dancing and be able to enjoy life again. So the energy level is one of the first things that we see turning around that's making this huge impact on these patients' lives.
So they start doing more, become more active, et cetera.
Right, doing the things that they want to do. I mean, I've got patients coming in and say, I just retired and now I have all the time in the world to do everything that I want to do, but I no longer have the energy to do it because of the hypothyroidism. So once we're able to turn that around, they can go travel. A patient who just bought a Winnebago and she wanted to travel the United States in a Winnebago. She wasn't able to do it. It had been sitting in her, in her straight for about a year.
So most of these people, or all of these people that you see, because when I first heard about your program, we're talking about it on the phone, I'm thinking you're giving thyroid, but you're not. You're supporting the thyroid. Most of your patients, 90% of them are taking thyroid. They're just not getting the results.
Right.
Do I have that right?
You do, right. Again, they're taking the thyroid hormone medications, which is important, but there's more to it than that.
Okay, so food allergy testing as well.
Yeah.
How does that play a role with thyroid?
Food allergy testing.
A basic understanding.
That's fine. Yeah, I could go into the whole physiology of it for you.
You really know that stuff. Do you really?
It's fun stuff.
Okay.
Yeah, I love it. It's so interesting because it really is a gold standard in how the body is responding and reacting to all the different foods and nutrients that you're putting into it. Okay. I mean, you ever hear them say one man's meat's another man's poison?
Yeah.
Okay, it's true. I mean, just because something's on a healthy list does not mean it's necessarily best for that specific patient, that specific system. So we determine exactly what is best for that patient. So we can develop
You have a test.
So we can develop an individualized, customized dietary plan for them. Because thyroid patients, they're looking for whatever is best, whatever diet is right for them because they're experiencing this weight gain, right?
Okay.
And you see all these different types of thyroid diets out there, a high fiber, low iodine, whatever it may be. But the bottom line is we need to understand what is right for that specific patient.
So there could be a food that they are eating every day that they're allergic to that's affecting their thyroid.
It could.
Really?
Absolutely.
Okay.
It's causing a constant inflammatory
science behind this, by the way? There's literature. It's in the literature.
Of course, I'm not just doing it because I feel like it.
Right. No, but there are experts that could disagree, but there's literature out there.
Right. Bottom line, once again, is results. Once we start applying these different things to our patients and we see results and we know what we do works, this is, of course, why we continue doing these different things. And it's really, practicing the functional medicine, understanding the patient as a whole.
You call it functional medicine.
Correct.
Elaborate on that.
Functional medicine is addressing the patient as a whole, understanding their underlying disease process, the dysfunction that's creating all of the different symptomology that the patient's presenting with. Once that's understood, we get the balance restored to the body, and then all of the symptoms, essentially resolve.
So and you say you see reversals every week, every day. Are you ever surprised, by the way, at the results?
Well, we're seeing reversals of the symptoms. Patients, overall are starting to feel better. I'm going to tell you, when we're talking about the autoimmunity, any destruction that's been done to the thyroid gland can't be reversed. And I'm not going to say that. Okay. However, the idea is to essentially calm the immune system down so that way it's no longer active. It's not recognizing or attacking the thyroid glands, essentially put into remission.
And that's Hashimoto's disease.
Correct.
Okay.
Right, which, like I told you, is the majority of the case for those patients.
I think you said 90%.
Yeah.
of these people. Okay, so you take care of that's the immune system attacking the thyroid.
Exactly.
Or interfering, I should say, with the thyroid. Is that right? Okay.
Right. It's shutting down the process of making thyroid hormones.
And what's your biggest frustration? You know, when you and the medical doctors and everybody's getting together, what's your biggest, what frustrates you the most about how hypothyroidism is being handled across the board in the U.S.?
Well, right now it's pretty much that every thyroid patient is being treated exactly the same. Exactly the same.
Which is with the pill.
Right. So they'll all come in with the same diagnosis, on the same medications, and if I can put all of their lab work up on the wall, which I won't, don't worry, HIPAA won't let me, but if I could do that and you could see just how different every patient is, it is still astonishing to me that they come in with the same diagnosis on the same medications. No wonder they're not feeling better. Their bodies are working completely different manners.
Interesting.
So that's what frustrates me the most about it.
What's the average age of the patient that you see?
Average age of our patient.
In the thyroid program.
I would say about 35, 40.
Okay, 40. And they're competing in the workforce at 50 and 60 is very young. And so mental clarity goes up. So when they start feeling better, they're sharper, memories are improved, obviously they do better.
Right, of course. I mean, we're seeing patients from a wide
Do people ever
age.
say, hey, I got a better job because of this, or?
Oh, absolutely. I just had a patient actually, she was a teacher, and at first she was concerned about her job. They were doing budget cuts with her. Anyway, she was concerned that she was going to lose her job. I mean, she was just nominated last month for Teacher of the Year. So, I mean,
and she was a thyroid patient.
She was a hypothyroid patient because her energy level has gone up. She was performing better at school. She was able to keep up with the kids and the other younger teachers. So because of that, not only has her confidence risen in what she does, but other people around her have noticed it as well.
Well, good. We're out of time. To get started, what do they do? What's their first move?
Well, they can go to the website. They can give us a call, come into the office, have a consultation.
It is a free consultation.
Yeah, it's completely free. I just want to discuss with the patient as to exactly what we do in the office, make sure that it really is a good fit for them.
Okay, good. Well, thank you so much for coming on the show. Great stuff,
so
great information.
Great.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you can visit our website at wellnesshour.com. Just put in thyroid or hyperthyroidism, if you could spell that, or you can put in Dr. Carter's name. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.